the ventilators with Jennifer Jackson, and after that we'll take a little bit of time, maybe past the hour, to try to respond to some of the other questions we've seen from all the topics. Go ahead, Jennifer.
Yes, good morning, good afternoon, and good evening to all. We had our session on ventilators earlier this week, and it was a very informative session. We started off with a really great presentation by Ale Velez from WHO, outlining the WHO resources that are available, including technical specifications, and how these might relate to other topics that we've already covered, because as we all know, ventilators are just one part of the larger ecosystem when it comes to caring for patients with COVID. This presentation was followed up by a really in-depth presentation by Tom Larkin, going over some of the really important details of the functionality of a ventilator and how those relate back to the physiology of the patient. Briefly touching on the different types of ventilation control, whether it's pressure or volume, and speaking to some of the different types of ventilators, as there have been many discussions about the larger, I would say, more intricate, complex ventilator technologies that might be out there, scaling down to some that are fairly straightforward in terms of their function, performing the essential duties that a ventilator would be expected to complete. Following that, we had Dr. Banguti from Rwanda sharing with us the clinical need, really touching on and a great follow-up to Tom's presentation, because as we can talk about the different complexities and the different, if you will, bells and whistles that might come with some of these new ventilators that are on the market, when it comes down to how to best serve all the patients, whether it's in LMIC or also in developed nations, if it's really not a feature that is needed right now, is it needed? And is there a way to scale up prototypes that really can address the basic needs for ventilation? And again, that could be through some of the more complex ventilators. There's also the high flow, non-invasive ventilation technologies that are becoming more and more, I think prevalent in the wake of COVID. Then I'm trying to think of what the other summary was. Most of the follow-up that we had based on these concerns, whether it was the cost, the ability to put some of this ventilation technology into the LMIC locations, really having to look at the education and how to use the devices. Because again, many of these different ventilators might have different ways to use them, and there's not always the availability of the training, whether it's the clinical training or the technical training. And as I mentioned before, really the topic on how to fully support these ventilators, not just from a human factors point of view, but also from the actual instrumentation and support. So oxygen supplies and how to best provide what is needed in order to have a functioning ventilation system. Following that, we did open up the session for Q&A, where we discussed some of the more prevalent questions, again, had to deal with the oxygen supplies and how we can look at different perhaps sources for oxygen. There was also discussion on the decontamination and what is the best and proper way for cleaning and decontaminating some of this technology before its next use on another patient. And other highlights that we discussed is using ventilation type technology in settings such as the OR. We did touch on the notion that, when these rich oxygen areas, such as whether it's the operating theaters or in some cases ICUs, but there is still that risk of fire. So again, it goes back to not just the proper use of the ventilator technology itself, but how to really be aware of the entire system required in the environment where the technology is being used in order to be safe and effective, not just for the patients, but for the staff using the technology. And we don't have a write-up just yet, but we look forward to having a full summary of this session that we did on Tuesday coming up in the next week or so. So thank you all, and that concludes my summary.
Thank you so much, Jennifer. We heard two amazing things from amazing encouragement and an amazing challenge from Adriana on Tuesday in the ventilator town hall. The encouragement was she had just come from the World Health Assembly of WHO that morning, where she said 20 presidents were speaking of countries and talked about medical equipment. And we all know at the back of a lot of people's minds in my country and probably yours is ventilators. So this is a big time in history for clinical engineers to step forward and help their countries around ventilators in the way we're trying to do now. The other thing, though, she said was that the huge challenges, and as Jennifer just spoke to, many people need training on the ventilators that are coming into their country. So I'd like, Adriana, you mentioned in your opening comments about how France stood up this WHO Academy, an AV resource that people like ourselves can come alongside and provide videos on training. Would you talk more about that, Adriana? That's one of the big challenges from all these 5 topics I know that remains.
But Tom and Jennifer, yes, actually one of the main issues is the products will appear now and will be available in the countries, but then what about the training how to use it, how to calibrate it, how to maintain it, and how to use it safely. So that's why WHO is now working with the WHO Academy to put these courses together. So we will welcome your expertise if some of you are willing to help on this area on the training, or you have expertise on training on either the maintenance, and so they have to be generic trainings. 2 consultants are being hired in WHO to put together that work and integrate all the input that we can receive from experts like you. So yeah, the main idea is to have this in the apps in the WHO Academy to be able to be helpful for those that are receiving the equipment. They are not branded specific, so they're generic. And we will still ask the manufacturers to give the specifics on their brands over.
Any other comments on that from the other panelists? On training, I can tell you CED will throw our full weight into, with all of your help, into providing good training here.
I'd like to briefly mention that there are 4 or 5 organizations providing free online training for physicians and nurses, Harvard University among them. We have a list of those that are available. They provide training and certification that may or may not be suitable for your particular setting. Also point out that the emergency use authorization of ventilators and other products has presented a real challenge for everyone, because it's not clear after the authorization has been suspended how those products might be used. It's a longer discussion, but I want to bring those topics up.
I want to mention that, go ahead.
I was going to say, just to quickly follow up, you know, we do have a question there that I think we will answer offline, but very much to Elliot's point, there has been an increased level of manufacturing, sometimes from non-traditional ventilation companies, trying to bring forth these ventilators for this emergency use. And the question was, how is the application? That's a very gray question to be answered, and with some thought applied to it. So we'll definitely get to that question offline.
I just wanted to point out the importance of the incoming inspection of ventilators that you purchase at this time, because they're being rapidly manufactured. We've had a lot of failures on the ventilators that have come into our shop, about 28% failure rate.
Could I just jump in there for a second?
Yeah, and I just want to make a comment about you, Tom. We had this amazing